Welcome to the brief just-in-time training module that will review the Viral Syndrome Pandemic Triage Protocol. This is a 2020 MIEMSS emergency protocol, and this training will familiarize you with the protocol and how it is best applied. Upon completion of this training, you will be familiar with the COVID-19 pandemic, recognize the signs and symptoms of COVID-19, review the MIEMSS Pandemic Triage Protocol, and be familiar with the documentation requirements associated with the use of this protocol. COVID-19 is a viral illness that originated in Wuhan City of the Hubei province of China in December of 2019. It has since become a global pandemic. It's much more serious than the flu and has a higher mortality rate. The virus is easily spread from person to person through respiratory droplets that are produced when the infected person coughs or sneezes. More cases are reported every day around the world, as well as here in Maryland. Unfortunately, we have seen a significant rise in cases since the original case here in Maryland on March 5, 2020. States of emergency have been declared in our country at the state, local, and federal level. We anticipate the need for significantly higher EMS and healthcare resources as the number of patients will increase during this time. There's a serious concern regarding the number of people who might require hospitalization and those who will also require ICU level resources. Signs and symptoms of COVID-19 may include fever, cough, congestion, shortness of breath, new body aches, and in some cases diarrhea. The most common symptoms are fever and cough. These symptoms can begin anywhere between 2 to 14 days after exposure. Around 80% of those infected will have mild to moderate illness. However, in the remaining 20% of those with COVID-19 infection, they can develop a complicated clinical course of illness. In some cases, COVID-19 can cause damage to the lungs and cause pneumonia, or a life-threatening condition called acute respiratory distress syndrome, or ARDS. Identifying a patient with COVID-19 or someone under investigation with COVID-19 has continued to evolve in terms of its definition. At the time of this recording, any patient with any of the following should be considered a PUI or person under investigation for COVID-19. That's any patients with fever or cough or shortness of breath or flu-like symptoms that include sore throat, congestion, cough, body aches, or diarrhea. Those individuals should be considered a PUI, and our EMS clinicians should take the appropriate protective precautions for the patient and themselves. Remember that the patient only needs to have one of these symptoms to be considered a PUI. This is important as the definition of a PUI is broader than the definition of who is eligible for the non-transport option of this protocol, which we will review in the coming slides. In light of this pandemic and the potential for unprecedented patient volumes for both EMS and our hospitals in Maryland, the leadership of the Maryland Institute for Emergency Medical Services Systems has instituted an emergency protocol entitled Viral Syndrome Pandemic Triage Protocol on March 17, 2020. This protocol seeks to identify those individuals who are safe to be managed by supportive care at home. It also serves to help the EMS clinician promptly recognize a patient who should be taken to the hospital because of high-risk criteria. This protocol can be used by both ALS and BLS clinicians. It's intended to help differentiate between those patients who can safely manage their care at home from those patients who have high-risk criteria and should be transported. The protocol itself consists of a checklist that guides the EMS clinician through a series of questions that cover inclusion criteria, high-risk conditions, and concerning exam findings. If any of the gray boxes are checked, then the EMS clinician shall encourage the patient to be transported to the hospital. If a patient has gray boxes checked and does not wish to be transported to the hospital, the EMS clinician shall follow the Maryland refusal protocol. In order to be eligible for the non-transport option within this protocol, all check marks need to be made in the non-shaded boxes. If a patient meets these criteria, then a refusal is not necessary. Also, I'd like to take a moment to remind you that as an EMS clinician in caring for this patient, you have the ultimate discretion to transport the patient even if no gray boxes are checked, if you have a concern and believe that's in the patient's best interest. If all checks are in the non-shaded boxes, the patient meets eligibility to provide self-care at home. A 3-page instruction sheet has been created and adapted locally. These instructions shall be provided to all patients who are not transported by EMS. This instruction sheet includes local phone numbers for the patient to use should they have further questions, as well as resources for them to connect with primary care. In accordance with MIEMSS guidelines, the EMS clinician shall document every use of the protocol under the newly created COVID-19 tab within eMeds Elite. The Elite questions directly match those questions within the protocol checklist. Also, note that a signature option of Not Signed, Patient Contamination Concern, has been added. This has been done to help minimize chances of contamination of our IT equipment. EMS clinicians shall complete the rest of their pre-hospital EMS chart per normal procedures. In accordance with MIEMSS guidelines, we are required to follow up with patients who are not transported under this protocol within 24 hours. As previously mentioned, it's very important that we obtain a good patient phone number for follow-up purposes. That phone number shall be documented in this area within the COVID-19 tab in Elite. Documentation of the phone call itself will also occur in Elite, and there will be an option for a follow-up visit as needed for certain patients. This follow-up phone call and possible follow-up visit will not impact field operations, and this will be performed through a separate headquarters function. Let's take a moment now to review a practice case of how we would apply this protocol. In this case, we have a 35-year-old male with 3 days of fevers. He has since developed a bad cough and body aches. His past history includes diabetes and seasonal allergies and gastric reflux. Upon vital signs, he has a heart rate of 104, a blood pressure of 132/64, a pulse ox of 96% on room air. His lungs are clear. He's breathing at a rate of 20 times per minute, and he's ambulating without any difficulty. Is this patient eligible for the non-transport self-care option within this triage protocol? Take a moment and think about it. If you said no, you would be correct. Since this patient has diabetes, he is considered to have a higher risk of a bad outcome from COVID-19, and it is recommended that he should be transported to the hospital for further evaluation. Let's try another case. Now we have a 42-year-old female with 2 days of body aches, cough, and general weakness. Her history includes that of high cholesterol. She has a heart rate of 110, a BP of 118/58, a pulse ox of 95% on room air, respiratory rate of 20, and she's ambulating without difficulty, and she's agreeable to stay at home, and she feels safe in doing so. Is she eligible for the non-transport self-care option? Take a moment to review the information. If you said yes, you would be correct. Since this patient does not have any high-risk features as identified by the Viral Syndrome Pandemic Triage Protocol, in other words, no gray boxes are checked, this patient would be eligible for the non-transport option. As a reminder, as the EMS clinician on scene, it's ultimately up to you to decide, even if no gray boxes are checked, if you think the transport to the hospital should be recommended. Thank you for watching this brief just-in-time training program. If there are any questions or concerns, please reach out to your local EMS Operations Program Leadership or contact the MIEMSS Office of the State EMS Medical Director at 410-706-0880. Please stay safe, take care of yourself, take care of each other, and take care of your families. Thank you.